I had my first hip replaced in January of 2012, and I had my second hip replaced at the end of March of 2012. During the day, I'm usually on my feet, I'd say 90% of the time. I work in autistic classrooms. Our kids go out of the classroom a lot, and then after school, you know, there's errands to run, or there's friends to hook up with, or we go out to dinner, or I come home and there's laundry to do, grocery shopping, all kinds of stuff, which still keeps me on my feet. So I am on my feet probably most of the day. I noticed something was wrong with my hips about 2 years ago, and it was really my left hip that was bothering me. It was like when I would walk, it would hurt. It was almost like bone on bone. And I had difficulty climbing steps, getting in and out of the car, even just walking around. Getting up from a chair was really difficult for me. It just got progressively worse. When I was doing my research about the traditional approach, the thing that I didn't like was the fact that it had such a long scar and it had a long recovery period. And there just seemed to be, from people that I had talked to about it that had had that, a lot of pain involved. The thing that I most liked about the SuperPath approach was the fact that it didn't cut any of the muscles or the tendons or ligaments or anything. It didn't do any damage, so to speak. It was great. I woke up in my hospital bed and I felt no pain. I felt no pain. There was a little ache, but no pain. Once I was a little more awake, I got up, and it was probably like 2 hours. I walked with a walker and a nurse because I was still groggy from the anesthesia. When I left the hospital, I had no restrictions as far as physical activity. Dr. Grandic told me to do what I felt comfortable doing. I was really surprised because I have some good friends that are physical therapists, and they were just blown away by that. They said, "You have no restrictions?" And I said, "No, I can walk, I can go up steps, I can do this, and you know, I can get in and out of the dryer." And they're like, "Oh, wow." I was able to start everyday activities probably 2 to 3 weeks after my incision was healed, and I just gradually do 1 load of clothes, and then gradually I could get up to 2 loads of clothes. I went in to see Dr. Grandic for my 2-week follow-up visit after my first hip, and he said that it was healing and it was doing so well, let's just go ahead and do the other hip. I have full range of motion in my hips, which is something I haven't had for a long time. I can cross my legs, and I can get in and out of the car, I can move it, it's just great. I think the SuperPath technique was the most positive thing that ever happened to me. It's great. I had, you know, from the beginning to the end, it was just incredible.
These results are specific to this individual only. Individual results and activity levels after surgery vary and depend on many factors, including age, weight, and prior activity level. There are risks and recovery times associated with surgery, and there are certain individuals who should not undergo surgery. Only a physician can tell you if this product and associated procedure are right for you and your unique circumstances. Please consult with a physician for complete information regarding benefits, risks, and possible outcomes.